Welcome to Season 3 of Students of Mind, the podcast that's all about opening up and normalizing discussions about mental health in ways that anyone can comprehend. In the first 2 seasons, we sat down with mental health experts and survivors to give you a full circle picture of each topic. In this new season, we will continue to explore the world of mental health through the insights of experts, healers, and individuals with lived experience. From alternative healing modalities to living with multiple illnesses, this season we will cover a wide range of topics with the help of a diverse selection of guests.
My name is Jayde, and today for our second discussion on psychedelic healing, myself and my partner Zen sit down to share with you my journey with Esketamine and ketamine-assisted therapy.
I hope by listening to the show you're able to learn something new and gain some encouragement through hearing our experts and listening to the journeys of our guests. However, this show is not a substitute for professional advice, diagnosis, or treatment. Always seek the advice of your mental health professional or other qualified health provider with any questions you may have about your condition. Never disregard professional advice or delay in seeking it because of something you have heard on the Students of Mind podcast. Hi friends, it's Jayde, and I am here with Zen.
What's going on?
Zen is here so we can have a conversation about my experience with psychedelic assisted therapy. So let's get right into it.
Yep. Okay, so let's just first talk about like what you're doing right now.
What I'm doing now?
Yeah. In terms of psychedelics, what are you doing right now, this period of time that you're in?
Okay. That's not where I expected we would start, but we could start there. So right now, I am currently part of a ketamine-assisted therapy program. And what they do is they facilitate at-home ketamine treatments. So they send you your medicine to your home, and you have a sitter sit with you when you have your session. So yes, right now I'm doing that.
So what got you into that? I asked you that at first just to put some context. Now, what even got you looking into that?
So back in 2019, 2020-ish, I was in therapy and had been with my therapist for a little bit at that point, and she was able to tell from what I was saying about my experiences with medication that the medications that I had been trying weren't working.
Weren't improving your quality of life, they were just keeping you at a baseline.
Yeah. And it was just like I would be going through the cycle of like getting on a medication and working for a little bit, and then it would stop working, and then I would have to switch. Yeah. So she kind of pointed out that pattern to me and introduced me to the idea of exploring like alternative ways of treating my symptoms, specifically my depression and anxiety. And she brought up psychedelics because
there was a lot of research going on about the use of them for different mental illnesses. And so she brought it up in session just to like put it out there. And then I took it upon myself to do some research. I think she did encourage me to like look into finding some research studies that were like recruiting participants to see if I qualified so I could get into that and get access to this type of treatment that way. And so on my own, I did some research and I found, so let me explain some more. I was kind of directed to look into ketamine, MDMA, and psilocybin.
Yeah, so I was going to say, like, I remember the first thing you bringing up was psilocybin. And I think it's important to note that at that time we were in the Bay Area. And the Bay Area, I'm pretty sure Oakland decriminalized it at that point. It was either that time or like a few months after, but it was definitely in the talks of being decriminalized. So I think that was like a big thing that your therapist brought up. And then you started like really getting, because I don't remember ketamine like being brought up at first.
Yeah, I think, you're right. Something you guys will realize over time is that sometimes Zen's memory of things is most of the time Zen's memory of things is way better than mine. So, yes, that is true. Yeah, it was like specifically MDMA and psilocybin. There were a lot of research studies going on at the time. So
you went from getting the recommendation and then
I did my own research.
So like, where did you search for that stuff?
So, I mean, a great resource is the MAPS website, which is the multidisciplinary something for psychedelic something. I'll put the link in the description. But that website has a lot of information, and they also, I'm pretty sure that's the website where they list current studies going on.
Okay.
So you can like see the current ones if they're recruiting, and then like information on how to get involved.
So at first you were looking at just studies because you thought that was like the only like
only
real legal way you would be able to get access to that stuff. Yeah. Okay.
Yes. So I thought that was the only way I was going to be able to get access, and
like it was known as something you could get access to, but it wasn't like how it is now where you're able to like go on. Or it's not publicly known unless you like really are into that stuff, and it's just like,
like now there's like these centers, like these psychedelic assisted therapy treatment centers. In 2019, when I was searching, those things, like I couldn't find those when I was searching.
People don't understand. COVID changed everything because it made it so that everything could be accessed online. And I mean, I feel like you were looking for the studies, and you're good at searching for stuff. So it's not like you're like looking online just on, where do I find some shrimp? Like,
no.
You were looking deeply for that, and you weren't finding it at the level that it is accessible now.
Yeah. And so that being said, that's how I came across Esketamine, which...
So how'd you come across that?
So in my search for research studies, I came across the term treatment resistant, which just means you have depression or anxiety or some other mental illness, and it doesn't respond to a certain amount of medications. So when I found that term, I started getting search results for TMS therapy, transcranial magnetic stimulation therapy, and esketamine, which...
What's TMS?
So TMS, which... that episode won't be out yet. TMS is a treatment that uses magnets to stimulate certain parts of the brain. This is a very short, chopped up version of what it is. You can find a lot more information about it online, but it's a treatment that's used for people who have like been on medication, a lot of different types of medications, and they didn't work, or they worked for a little bit and stopped working. And this is something that's supposed to be more effective for those people.
So you're seeing that along with esketamine?
I was seeing that and esketamine. Mm. And so I found a treatment center in San Francisco, which it was close to where we lived, that did not only esketamine and TMS, but also regular psychiatry services. Mm. So I reached out to them to see, initially to get signed up with one of their psychiatrists so I could just get in there. And then once I was in there, we talked about the fact that I had talked to my therapist about looking into psychedelic assisted therapy, and talked about ketamine briefly, and then she explained to me what esketamine was and put me through the screening for it. And then once they saw that I qualified, I was able to start treatments.
So what about esketamine, like that you were seeing online? What about that was saying like this would actually, or gave you hope that you would actually be able to see some relief from it?
So what I read was that what esketamine does, and ketamine too, is it like opens up your mind, or like gives you this like third person perspective on your life, so you're able to view things from a more neutral place. Like I was reading that it allowed you to feel less blended, less attached to like your symptoms and like what you're feeling, and like view it as if you're like another person, so you can like see the reality of the situation.
That's what you were reading before.
Yeah, that's what I was reading. And like this is like searching online and like looking at research studies, but also like I also went on like Reddit, yeah, and like looked to see like what people were saying they were experiencing in these sessions.
Yeah, bro, like I mean, I've never taken any of these substances, but like if you just find forums, like I know like we're supposed to look at research studies, but I can really attest to just looking online and seeing what personal experiences people are going through, because like you know, especially places like Reddit, like yeah, somebody could be lying, but like why would they be spending all of their time on this app? Like Reddit don't pay like YouTube.
Yeah.
So like yeah, if you're really looking for stuff and you can't find anything online, there's somebody on Reddit talking about it. There's a group of people on Reddit talking about it, because I remember going on that subreddit.
Yeah, because I showed it to you. Yeah, and that was helpful going on there, because it like told me what to do like practically, because like when you go in for esketamine, it's a nasal spray and it drips down the back of your throat.
Yeah, so let's go to like what esketamine was like. Okay, like don't talk about your first experience or your first appointment. Talk about your like overall experience. What was like the average experience like on ketamine? Like going from me dropping you off in the car to me coming back and you coming back and into the car.
Okay, so yeah, so with esketamine, so I did esketamine treatments from December 2020 to June 2021. And so basically on the days that I would have esketamine, I would make sure before I went to eat at a certain time, because I had to fast.
How many hours?
just 2 hours. So yeah, I would make sure to eat breakfast and lunch before my appointment. And then I would also take a shower as a way to like relax, and then do yoga and or a meditation. And I would do this like in the like 2 hours leading up to you taking me there, as a way to like calm my body. 'Cause like
It was nerve-wracking because there's some crazy stuff that you went through.
yeah, it's like it's an intense experience, and if you go into it tense and
Your trip will...
it's not gonna go well.
Yeah.
So I would do all that I could to relax my body and like calm my nervous system.
Mm-hmm.
And then we'd get in the car, we'd have our talks on our way there, and
Set intentions.
yeah, set intention. Oh yes, that's the other thing. I always write out what my intention for the session will be. Usually my intention is just a phrase. That way in the session it's easy for me to remember it. But yeah, I would always write that down. And then you would drop me off. I went in the office, and every session I would first have like 15 minutes with my psychiatrist. We would talk about how I was doing in general, how my last session went, and then talk about any medication changes that we need to make.
Yeah, because she was your psychiatrist.
Yeah, because she was my psychiatrist, so she was in charge of that.
Mm-hmm.
And then she would just ask me if I needed any extra support going into the session that day. And then I'd always say no because I like doing my sessions kind of on my own. And then I would go into a different room that had a chair, like a nice lounge chair, and I would bring... Oh my God, I have to go into what I bring.
Yeah, I was about to say, like, you would be dressed down to
the
cozy.
I would be dressed in my coziest clothes, hoodie, leggings, fuzzy socks, slides. I would bring a fuzzy blanket every time. And then my headphones, because music is a must. My phone, of course, to play music. I would bring an eye mask, mints, because, like I was saying before, the medicine can drip down your throat, so it tastes bad. Mm-hmm. And yeah, I think that's everything I would bring. And my journal. Mm-hmm. And so, after my session with the psychiatrist, I went into that cozy room and set up. And then a nurse would come in and administer the esketamine in 10-minute intervals. So depending on what your dosage is, you get a certain number of nasal sprays. So for esketamine, it's a lot lower. So esketamine, the highest dose I was on was 84 milligrams. Yeah, and so for me, I had 3 nasal sprays. So
like, what did you start with? It was like your first session? I think it was
like 50.
Okay.
Yeah.
And then so like, what would so let's just say like a normal session in there, like how would it go? It would be like the nurse would come in, you'd get your first nasal spray, and then like how many minutes until you started like noticing effects? So
I would say like in the first half of like my entire experience doing esketamine, after 10 minutes I would start to feel effects. A little further down the line, it would take after the second nasal spray. That's when I would feel effects. So the first one I would kind of not really feel anything, and then I would take the second one and then I would feel something.
So you built up a tolerance.
Yeah, and that is something that's the thing with ketamine specifically. And I think with esketamine, you build up a tolerance over time to the psychedelic effects. So, like, the antidepressant effects are still there, even if the psychedelic experience is very mild. So that's why, like, if you go into an experience and you don't really see much, that's okay, because it's still in your system, and those effects of the, like, antidepressant part are still gonna help you.
Okay, so, like, what are the usual symptoms you would, well, not symptoms, but what are the effects that you would usually start to notice first?
Like
visual, auditory,
what I would see, like what the trip was like. So for me, and I've only done esketamine and ketamine, so I don't know, if I explore other psychedelics, I might find that
that's another episode.
Yeah, it's different. But for me, each session is generally, it has the same summary. It has the same, like, outline and structure. So I always begin, like, laying in a room. So everything I see is, like, I see it as if it's, like, real, as if it's, like, my eyes are open.
But your eyes are closed.
But my eyes are closed, yeah. My eyes are closed and I have an eye mask on. And I don't see things in color in my sessions. A lot of people do, but I don't. I see everything as if, like, someone turned off the lights. So it's, like, kind of in black and white, but it's more so like someone just turned off the lights and everything is dark.
That's crazy. I didn't even realize it was like that.
Yeah. So, yeah, I don't really see too much color. It's like...
That makes sense, though.
Yeah.
Yeah.
And so a session for me is, like, I feel like I'm floating through these different rooms and sometimes, like, outside landscapes. And, like, sometimes it feels like I'm being pulled by something. Sometimes it just feels like I'm, like, literally just, like, floating into these different places. And each room is different. Each room has objects in it, has windows and doors, and has different ceiling heights. And, like, one time, I remember I told you this, I saw, like, a temple. That was the one time I saw something in color.
You said it was golden, right?
Yeah, it was gold. So, yeah, I see these, like...
Would they be, like, things from real life? Or, like, from that were, like, specific to you?
So, I didn't start seeing things from my real life until I started ketamine.
Okay. So, in esketamine, it was, like, just...
things I've never seen, places I've never been to.
Right.
Things that I couldn't recognize, that I didn't feel like I've been.
Yeah.
But now in my ketamine experiences, it's like, even if I don't recognize it visually, sometimes it feels like I've been in this room before.
Right. Okay, so yeah, before I go on, what are the differences you notice between esketamine and ketamine? Besides the way you take it.
Yeah. So I would say esketamine to me felt more consistent. Like, I knew what to expect every single esketamine session. Whereas with ketamine, because of the way it's administered, the company I use does the lozenges, and it's absorbed through your mouth, which...
I mean, it's really absorbed through your freaking stomach. Because...
And that's the reason why it's not as consistent.
Depends on your gut,
right,
basically.
It depends on the state of your gut. And if anyone knows me, my gut is all sorts of fucked up. So but yeah, so I think that's the main difference.
Okay, well, if you...
That's really...
That. But, okay,
really
so let's go on to, like, the adverse effects that you had, because you definitely had some adverse effects during esketamine and as well as ketamine. So like, let's first start with like the ones during esketamine, some of the incidents you had.
So, all of the times where something went wrong is when I was like working before I went in for a session, or I was like rushing to get there, or I don't know, just if anxiety was high and I didn't do much to bring it down before a session, usually it would end up not very good. So one time, I remember there was one time when I got anxious, or no, where I was really anxious going into a session, and I took all 3 nasal sprays, and it was taking a really long time to start, and so I was gonna text you, but I didn't, because the thing about ketamine and esketamine is that like the physical side effects are pretty intense. So yes, and this is something I also learned from Reddit. But before I went to sessions, I would take an anti-nausea medication. I still do, because one of the most common side effects is nausea and vomiting. And I am terrified of vomiting. So that was like a big fear of mine when I was first going in. Luckily, taking the anti-nausea medication does the trick for me. There was one time when it didn't do the trick.
You barfed.
And I threw up
in the office.
In the office on their carpet.
Dang, every time I think about it, it's on a floor that's cleanable.
No, it was on the carpet. Yeah.
It's brutal.
That was the last time I ever went there too.
Yeah, that was the last time, because that's brutal.
Yeah. But yeah, that happened because we were out of town. I hadn't had a session in a long time, and then I went in and did the full dose after not having done it for weeks, and it was just a lot on my system. So
yeah, and tell us about the nurse too. That was like,
oh, so when I'm in a session, like in the trip, it's very easy for me to get out of it, in the sense that like it's very easy for me to like get distracted by outside factors, and then the psychedelic effects get decreased. And so something that I had to deal with at this particular treatment center was a nurse who was kind of loud. And so if you go in for esketamine at a treatment center, I'm pretty sure they're required to take your blood pressure every so often to make sure it doesn't...
Every 30 minutes?
Yeah, every 30 minutes. To make sure, because I believe esketamine increases your blood pressure. So they would just want to make sure it's not getting at a scary level. But there was one nurse who just loved to talk to me.
Let me say it more accurately. She was not trained well.
Yes.
She was not trained well.
Yeah.
She didn't know how to interact with people who are undergoing a psychedelic trip.
Yeah.
And you told...
Yeah, I talked to my psychiatrist about it, and after I talked to my psychiatrist, it got better. Like, we actually moved to a different part of the building, and which honestly helped with noise, because I could sometimes hear like other psychiatrist appointments happening, which would like interrupt things too. So yeah, after I told my psychiatrist, things got better. Like, I need to remember that in times where I'm scared about advocating for myself, because that's a clear example of me like advocating for myself, being like, this person is interrupting things, like the things going around the office are interrupting things, and I need it to be better so I can have an effective session.
So like, yeah, like, don't be afraid to, and this is the other thing, is that since this is new, relatively new on like you can come into an office and get esketamine.
Yeah.
they're going to be extremely receptive to your requests and your feedback, because this is their first time doing it on a professional level. Like, I'm pretty sure, like this isn't like going into the middle of the woods with a shaman and nothing like that. Like, this is like in a hospital.
It's like a medical regular medical facility.
So, they're gonna take what you're saying extremely seriously.
Yeah.
Not to say that if you go into the middle of the woods with a shaman, they're not gonna take it seriously.
Yeah. Right. Yeah.
And
I will say that, like, doing treatment in that setting was great for that reason, because they were constantly checking in with me to see what they could do better and to see what my experience was like, because, like you're saying, this is new and they need all of the information that they can get. Hi friends, Jade here. I wanted to pop in because this episode is pretty long and I know it can be a bit overwhelming to consume so much information in one sitting. So I encourage you to take all the time you need to listen to this episode, and take this moment with me to take 3 deep breaths before we continue with the show. First, let's exhale and release all of the breath that we currently have. And let's begin. Breathe in. And breathe out. Breathe in. And breathe out. Breathe in. And breathe out. All right, let's get back into the show.
okay, so let's talk about ketamine now.
Okay.
So let's go into more depth about the difference between esketamine and ketamine.
Okay.
Not necessarily on like a chemical
Yeah,
level.
because I'll talk to Aubrey about that.
Yeah, but talk about the differences that you're seeing and why you didn't go with esketamine versus ketamine.
Well, I probably would have continued with esketamine if some life circumstances didn't happen. This is important to mention. Ketamine is generally not covered by insurance, but esketamine is.
And why is that?
So esketamine is newer, and I believe it's like they took a part of ketamine and used that as opposed to using the whole molecule. And it's at a lower dose as well. So I wanted to continue with ketamine, but when we
moved to LA.
Yeah, we moved away from where I was getting the treatments before, and at the same time at the move, I went through insurance changes, and the new insurance that I have does not cover esketamine. And that's the thing, it is newer, so there are still some insurances that won't cover it. So yeah, I just couldn't get it covered by my insurance, and the out-of-pocket for esketamine was a lot.
Say how much it is.
It was like, I have it in my notes.
I remember when you were talking about getting esketamine at first, it was like $450 per nasal spray. Something crazy like that.
Okay, here it is.
So the observation by itself, so
Observation.
the medication was $875.
Per session.
Yes, that's for 84 milligrams. Okay, so that's for 3 nasal sprays. It's
Okay,
$875, so per session. Plus $450 for the observation.
So you're looking at $1,200-1,300 per session.
Per session.
Without insurance.
Yeah, so that's out of pocket. Every time you go to the office once a week, you pay that much.
So you're looking at $5,000 a month.
So
without insurance.
Yes, without insurance.
So with insurance, what was the...
So all I had to do with insurance was pay a $20 copay.
For each
session, yeah.
So instead of $5,000, you were paying $80 per month.
Mm-hmm.
Nice. Go insurance.
Yeah. But my new insurance didn't cover it, so I had to look for other options, and that's when I found New Life.
So how'd you find them?
How did I find them? Honestly, an Instagram ad.
Yeah, I remember that.
Yeah.
Wait, did I send that to you, or did you find that?
I found it because I had been getting ones for my ketamine home. So yeah, I found it on an Instagram ad and just like went through the process of their intake process, which was just like screening you to see if you had treatment-resistant depression, getting consent from the other providers that you're working with. I think it's required that you are working with like a therapist or a psychiatrist, and so they get like written consent from one of them that you can do this treatment, and then they start you on the medication. Well, they send you like orientation stuff to get you ready to help prepare your sitter, because it's usually like someone you live with or a friend, and then they send you the medication and you can start.
So what was the insurance process with that?
So this company does not take insurance. It is all out of pocket.
How much?
So the program I did was $2,400 altogether. No.
Oh, okay. How
in total. And so that was for 18 sessions. Yeah.
Oh, that's pretty good.
That's really good.
That's really good.
It's
okay,
really
let's
good.
do the math on that. So 2,400 divided by 18 is about $130 per session. That's good. Okay. I thought it was more than that. I didn't know. I'm finding out this information for the first time too. Okay, so like what are the differences that you're noticing in terms of your actual trip? Because the other thing is like you're not doing this at an office anymore. Right. You're doing this in the comfort of your own home.
Yeah.
Now. So, what is that? What does the preparation look like differently?
So I have to be really intentional on ketamine days and like not do any work.
Yeah, I'd be having to yell at this girl to not work and get in the tub.
Yeah.
I mean, she's doing a lot better.
I'm getting better, yeah.
But yeah, so you have to be extremely intentional on these days.
Yeah.
Like, what does the day look like differently than your normal day?
So I get up. My morning is usually the same. I kind of have a morning ritual that I do every morning, which is get up, breakfast, meditation, and then gratitude. Not gonna lie, I haven't done gratitude in about a week and a half.
What, you write in a journal? You say it out loud? What do you do with gratitude?
Either one. I just have to do it.
Okay. What does it usually look like?
It's usually writing in my journal.
Okay.
Yeah.
Well, you just like write down things you're grateful for?
I just have to write one thing that I'm grateful for, and then at the end of the week I go back through and read all of them.
Oh, that's not bad at all.
Yeah.
Get back on that, bro.
I know.
Come on, bro. I thought it was some crazy thing you had to do. Bro, you gotta write down one thing?
Yeah.
I'm gonna be on you about that.
Okay.
You shouldn't have told me.
Yes, so I do my morning ritual. Usually on ketamine days, I take a walk in the morning, and then I try to do things like reading, journaling, art. I definitely journal about my intention for the day. I have a list of intentions that I usually pull from, but I always like journal about how I'm feeling during the day and like what I want to accomplish in my ketamine session. Or not accomplish, but like what I want the vibe to be. So yeah, I do that, and then I have lunch early.
Early, like how early?
So my lunch is at 11 because I do ketamine sessions at 2 or 3. So I eat breakfast at like, well, my breakfast is crazy. So we'll just pretend I eat breakfast at breakfast time, and then I eat lunch at 11.
It's not even true though. You be eating breakfast. Look, come on, bro. We not gonna capture them. She be eating breakfast at 4 in the morning, 5 in the morning.
Yeah, I do eat breakfast at like 3, 4, 5 in the morning. And then lunch at like 11. Sometimes a snack between breakfast and lunch. And then after lunch, I do my coping and grounding routine.
What is that?
Which is, it's something that I've kind of developed after being in treatment this year, because I needed a way to like incorporate practicing coping skills and grounding skills every single day, because they only work if you practice them both when you need them and when you don't need them.
Yeah, consistency.
Yeah, so it's something I do every day. I practice a coping skill and a grounding skill, and do a brain dump. A brain dump is just like writing out what my thoughts are in my journal. So I do that after lunch, and then I get in the bath. While I'm in the bath on ketamine days, I try to refrain from TikTok, and I make a playlist. That's kind of new. That's been in the last like 4 sessions.
What? No TikTok?
Yeah, no social media before.
Good.
So yeah, I like make a new playlist for the session, or like go on Reddit and look for a playlist that someone else has made, and
that's cool.
And listen to it and make sure it doesn't have any words.
Yeah, so talk about that. You can't.
Yeah, so and this isn't for everyone. Like, there's plenty of ketamine playlists out there with words, so there's a lot of people who can listen to music with words during a session, but for me, it freaks me out. Like, it makes me feel like there's someone next to me talking into my ear.
Ooh,
like it's really uncomfortable. So yeah, I take my bath, make a playlist or find a playlist, and then I get out of my bath and set up my space. So I do mine in my bed. I don't do it on the side that I lay on. Like when I go to sleep, I do it on Zen's side of the bed, just to kind of differentiate the resting space and the ketamine space.
Why do you Palo Santo? Why do you sage?
So that's my way of showing like respect for the medication. That's something that I've, through conversations that I've recently had with psychedelic people and through books I've read, an important part of the psychedelic experience is showing respect to the medication, and if applicable to like the culture behind the medicine. And so ketamine's a little different because it's a synthetic, but I still do things to like show my reverence, because at the end of the day, this medication has helped me tremendously.
Yeah, so go into that. Has it been a successful decision to use ketamine? Or has the decision to start using psychedelics and within your normal treatment, has that been successful, and how has it been successful?
It's been very successful. I think that it's just given me space to process the things that I need to process to actually heal. Like ketamine specifically because Like, this session of ketamine, like, I started right after I left being in eating disorder treatment this year. And I was in a really low place. And that was only, it's November, October, September, August, July. That was only 5 months ago. And like I couldn't work at all 5 months ago. I couldn't go spend time like with friends, like out, like go out at night with friends. I couldn't do that.
That day.
Even yeah, like I couldn't not just go out with friends, but like interact with friends, reach out to friends. Like I couldn't do that. Yeah, I just had, I still am low energy now, but I had less energy then. I'm way more motivated now. Like I'm able to, the negative thoughts are still there, but I'm able to like correct those negative thoughts or like.
Yeah, I mean, you're basically not extremely depressed.
Yeah.
Because everybody has negative thoughts, but it's just that you're able to handle them.
Yeah, I can handle them now.
Yeah.
Or, yeah, I can cope with them now. Yeah. I can, like, listen or, like, watch new things now. Like, before, like, for months, I was avoiding watching new things because I just have this thing where, like, watching something new makes me anxious because it feels like I have to create, this is bad, to create, like, an emotional attachment to this new thing when there's so many other things I've watched that I really like that I can just go back and watch again. And that feels better for me on like anxiety terms. But like now I can watch new things. Like we've been watching new anime recently. I'm able to like acknowledge my progress more, which is something like my therapist has pointed out to me, is like we spend a lot more of our sessions like recognizing where I am now, and like it's not always prompted by her. Like I'm able to see it myself. Yeah, these are just some of the things.
Do you notice anything like physically more energy?
I did write like slightly more energy. I think I have chronic fatigue, so that's a thing, but yeah, definitely.
On the same level would, but
yeah, I definitely like I'm doing so much in a day compared to a few months ago. And yeah, like I have the energy to do this, like the podcast, and starting like different avenues of things for the podcast, and like working on multiple things at the same time. Like, yeah, I didn't think that was possible a few months ago.
What about, that's really the last question I have. So talk about that period where you were kind of avoiding doing ketamine. Because yeah, that was a good thing. So so when I first started with this company for ketamine, my first session with them was honestly really terrible. Yeah, because they gave you... They gave me... Yeah. Right? Because I had been on esketamine, what they thought was they could just give me an equivalent dose of ketamine. But the thing is, I hadn't taken a dose of esketamine or ketamine in months. And so the dose they gave me was just too high for my system. And so it was really, really intense, like, not just after, like, I'll get into what happened after, but, like, during it, I felt like, this happens now, like, I become objects during my session, but in that session, it was like I became the object, and it was like I started to forget I was me.
And like,
okay, talk about the object you were.
a shelf.
Yeah.
That's what it always is. Yeah, I like turned into a shelf, and I was just having a hard time, like.
So you're saying, like, usually it'd be like inanimate objects, or always? Always inanimate. So use a shelf. Use this one right here. It's not funny, but we gotta make humor out of it.
Yeah. Yeah, and then after that session, I was throwing up.
Yeah.
All over the place. Shaking, like hot sweats, cold sweats.
Yeah, she was busted down for like 2 days.
Yeah,
after that.
it was rough. Yeah. And then I had the doses to do my next session, but I just avoided it, and I was like, yeah, I'm gonna do it. I'm just waiting for this. But it was really because I was avoiding it because I was scared.
Yeah, you're scared.
And so
I got turned into a shelf and forgot I was a human.
Yeah.
Boy, I would do it every day.
It was just like I could not ground myself. Like, no matter how much breathing I did in that session.
I know the exact feeling you're talking about. Like,
myself.
You start to lose a sense of self, and you don't believe that you're going to come back to what you're trying to grasp onto.
Mm-hmm. But this is only something that happens if...
No, I think people should know the risks, and they should know what's normal, because that hasn't happened just once, right? That's normal. So it can happen. It can happen. And it's going to look different for everybody, obviously. This is Jayde's experience. But, like, yeah, bro. Like, you need to know what you're putting in your body. It's not a game. This is medicine. Intense, extremely intense medicine. Yeah. And, I mean, you have had great results. So it's like, it was worth the risk.
The risk, yeah.
Oh, yeah. So, like, what we've talked about you doing, like, ayahuasca. We've talked about doing shrooms a little bit. I don't know if you're like really into doing psilocybin or anything like that. I'm not into this stuff at all, by the way. Like, I'm just putting that out there. I'm just here. I'm just watching Jay going through this stuff, and I'm just, her sitter basically. So, but I think it's interesting, this world that you're getting into, because I think culturally, like, as black people, like, it's kind of just like left to the weirdos, to you're into that stuff,
you're into that
boy, who are you judging? But I think it's real interesting that you're getting into this type of stuff that I think a lot of people judge those who are like not even really into, but just, it's normal for certain people. And we kind of, think, oh, if you do this stuff, you're a hippie, or you're, like, crazy, or, whatever judgments they make. But you were kind of, like, exploring it from a very medical point of view. Not to say that if it's not, medical, or if it's recreational, it's not. But I think this journey that you're going on helps legitimize what a lot of people are doing in this community. So what are you kind of looking forward to doing? Like, these ketamine sessions aren't going to last forever, right? Yeah. So what is your plan after this?
Yeah, that's honestly something I'm trying to figure out myself. I think my time with ketamine is about to be done relatively soon, so...
What are your thoughts around that? Like, are you scared? Are you...
Yeah, I am nervous, and, like, this is something that I've talked about in therapy, like, starting to, like...
I mean, I'm wondering about that, too, because, like, bro, it's been helping so much. Why are we stopping? That's how I feel. And that's the thing about ketamine, is that, like, again, it's still being researched, and it's, like, there isn't a recommended duration. Let's keep in mind, a lot of these meds that people are on don't have one either.
Yeah. So
I think something you're learning is that it's normal to taking a substance, or it's not like we look at substances for the mind similarly as we look at them for substances for the body. So like, you're sick, antibiotics, 2 weeks, done. Whereas mental ones aren't really like that. Like, you've been on meds for
over a decade.
Right. And you've switched some, obviously.
Yeah.
But like, they're all kind of like for the same things. So like, I think it's interesting that for ketamine you're kind of coming off of it as if it's not, as if it's like a physical medicine.
Yeah.
What do you think about that?
Yeah, I mean, I just think, like, I mean, part of it's financial because I do, like, have to pay every time I want to, like, get more doses. Part of it is, like, me wanting to not have to rely on medication. But, like, I agree with you. Like, I would, if it was up to me, I would just continue with this. If I could get it like another medication and like just pay $10 once a month for it, like I would continue doing this for a long time because it's helping so much. But yeah, I just don't know how practical that is for me right now. And I'm interested in exploring, because ketamine is one of the like lower level psychedelics, and so I'm interested in exploring things like ayahuasca, and seeing how that could help me. And that's another thing where like the finances come into play. You need to have a good chunk of change to be able to afford to go to a place that's a good, safe place to get an ayahuasca ceremony. So I'm like waiting for that period of my life to come. This program recommends that after you're done, they didn't recommend it for me because my situation was weird at the beginning, but they recommend that you take 3 months off of ketamine.
And you can go back on? Oh, cool.
If you want, yeah.
Okay.
So they recommend 3 months off, just to kind of see how you are and to give, like, honestly, to give your liver a break. They ask you to get liver function just to make sure it's doing okay. Yeah.
That makes sense. Okay, well, let's come to the conclusion for this episode. Are there any other things you want to tell the audience about your experience?
Just that this is only my experience, and everyone's experience with psychedelics is different. I've only tried ketamine and esketamine, so I think this is just like the beginning of my journey. I'm very grateful for the way that they have helped me and allowed me to process things more effectively and just like be a little bit more settled. Yeah.
Any tips that you recommend to people who are, starting their first trip, or just general ones, not gonna be specific, but things that have worked for you, seen made a big difference?
Have a sitter. Even if they're not like in the room with you, just make sure someone's around. Music. I feel like music shapes each of my sessions.
Yeah, because you talk about how you get pulled into different rooms when the
music changes. Yeah. So I think music and psychedelics go hand in hand. So I think it's always a good idea to have a playlist that is comforting. And breathing. I think the thing that helps me whenever things feel like they're going south is my breath. So just like counting it in my head or out loud and taking like really slow, deep breaths. always brings me back to being grounded. Yeah.
All right, buddy.
Alrighty. Thank you.
Yeah.
Hello. This is Jayde again. I'm popping back in here for a few minutes just to give some updates because this episode was actually recorded in November of 2022 and it's being released in January of 2023, and some things have changed, and so I just wanted to give a little update. So I actually took a break from ketamine treatments, and as of now I've been off of ketamine for about a month and a half. The program that I'm a part of that administers the ketamine to me does recommend taking a break after you finish your program. And so that's what I did. And unfortunately, during this break, some symptoms have come back. And, I just wanted to be like totally honest because I want people to get a very clear picture of what my experience has been with this medicine. And honestly, these past few weeks without it have been pretty difficult. I've noticed a few symptoms coming back, which I'll list off to you now. The first and probably most difficult one to deal with is my ability to cope with change. That's a big theme in my life, just having a tough time coping when something changes, even if it's something really small. And for a minute, I was doing a lot better with that. I was doing a lot better with, recognizing that if a change happens, it doesn't mean it's a bad thing. And like, I don't need to panic when there's a change of plans or like a change of schedule. Like, I got to a place where I was like, it's okay that things change sometimes and I'm safe when things change. But in this past month, I've noticed just the feeling of that, like feeling very out of control and panicked when things change, and having a really hard time coping with that. And usually it has led to some like irritability and I wouldn't say resentment, but just like just a really uncomfortable emotion. I'm trying to explain this as best as I can, but it's like, I'll give you an example. So something that I do for my mental health is I plan out all of my days. So I have a spreadsheet that's split up into the different days of the week, and I break it down into hours, and then I like schedule out things for each hour of my day. One of the things that I have to schedule out are like meals and cooking for meals. And so in this example, it was a day where I had planned to cook, and there was a change in that plan that wasn't really talked about. It just happened. It was someone else cooked instead of me. And usually that would be fine. Honestly, it would usually be even better that someone else was cooking because I could, do other things. But in this instance, it made me so uncomfortable that the thing that I had planned to do wasn't going to happen. And I got really anxious and really irritable. And I knew because of this period I'm in that the irritability was kind of baseless, in the sense that like I didn't actually need to be angry or upset or annoyed that someone else was cooking, but it was so jarring to me that it caused that irritability. And so I literally just left the house and like ran some errands to kind of get that irritable energy out in a way that wasn't going to be like taking it out on someone else. And I've had to do that a lot recently. Like getting out of my environment to just like reset when I feel an uncomfortable emotion, because they've been really intense lately. So that's one thing is the struggle with coping with changes has been increased since stopping ketamine. Another thing that I've noticed is just the feeling that, and I don't know if anyone can relate to this, but just feeling like things are piling up so high that you can't handle them yourself. This was something I experienced this time last year, which is like right before I went into eating disorder treatment. And I was just feeling like I had so many things to do, so many like adult things, so many work things, so many like mental health things. There was just so much to do that I felt like it was getting to a point where I couldn't handle it on my own or with some extra support. So that feeling has been coming back lately as well. Another symptom that I've noticed coming back is just the persistence of my negative thoughts. I was in a period while on ketamine where reframing negative thoughts was a lot easier, and like moving on with my day after encountering negative thoughts was a lot easier. Whereas now I get very tied up in those negative thoughts and kind of like stuck in the thoughts, and that leads to like crying spells and like just feeling like I can't move or do anything because the negative thought is so intense. That's been really difficult, and for me, since my eating disorder is a part of my life, a lot of the negative thoughts lately have been around my body, which just adds another layer of difficulty to deal with. So that has been pretty hard. So yeah, those are the things that have been coming up since stopping ketamine. I stopped for about 1.5 months. I am going to be starting another ketamine program in the next like week or so, which I'm really excited about. I'm excited to get back into the space that I was in, and to have some more like chemical support around the things that I'm experiencing. I'm just, looking forward to the openness that for me comes with ketamine, because I felt myself begin to start to like close off again in these past few weeks. And I'm just looking forward to kind of getting back on track with things. But I will say that things didn't go completely down the drain in this month and a half of being off of the medicine. I still was able to do self-care, and I was still able to do my work and spend time with friends and family. So yeah, I just wanted to give this little update because I am still very much on this journey. I'm still learning about these types of medicines and this type of healing, and learning what works for me and my body and my experience. So I hope this just gives you a little look into what utilizing this modality could look like. But yeah, that's it. And I will be continuing to share about this aspect of my healing journey over on Instagram and TikTok. So if you're on there and you're interested in hearing more about this part of my healing journey, be sure to follow me there. Thank you for listening.
Thank you so much for listening to this episode of Students of Mind. I want to say thank you to Zen for being on the show again to interview me. I feel like he does a really good job of helping me tell my story, so thank you again, Zen, for helping me out. If you want to continue following my journey with psychedelic assisted therapy, you can follow me on TikTok and Instagram at Jayde M. Barber, and that's where I'll be sharing updates on what I'm doing in terms of psychedelic assisted healing. If you have a moment, please leave a rating and review for this episode. You can do so by scrolling to the bottom of the podcast show page on Apple Podcasts or Spotify, or by using an app like Podchaser. Ratings and reviews help me know that these episodes are landing for you, give you an opportunity to give feedback, and get all of these episodes into more ears. Don't forget to go to newsly.me and use code STUDENTS to get a free premium subscription to the all-new Audio Super App. Thank you so much again for listening. I hope you learned something new or resonated with something you heard today, and I will see you next episode.